you've got pets, and most of us do. I certainly have my beloved fur friends. Sometimes they're in pain. And what do you do? What is it? How can you recognize it? What do you do about it? So our expert today from Paws Rehabilitation and Wellness Clinic, we've got Dr. Leonda Armstrong back. Great to have you on with us.
Thank you, Sandy, so much. It's always great to be here. I always enjoy our show.
Love it. Sorry I'm a week behind, but I think I'm catching up fast. Okay?
Excellent, excellent. It's okay to be behind.
And that's
sometimes.
painful, right?
It can be,
It
depending
can.
on where it is.
Well, you know, this Paws, and of course, and you're the owner, certified veterinary. You do acupuncture, you do all kinds of things, including canine rehabilitation, and you're the owner of Circle L Animal Hospital as well, and Hacienda Canine Resort and Spa. Anyway, you've got fun things for pets, fixing pets, and then rehabilitating pets as well. But this is important. You know, I've got a couple of senior animals, a senior cat, a senior dog. Pain. What is pain for an animal? Is it different from us?
So pain is actually quite different for an animal than it is for us, and we oftentimes think that when an animal vocalizes, they're in pain. But actually, vocalization is one of the last signs that you're going to see when a patient's in pain. So further in this segment, we'll kind of go through everything that you can use, signs and symptoms and very subtle things to watch for that will identify pain for us. But the interesting thing is that pain comes from the Latin word piona, which actually means a fine or a penalty. I thought that was really interesting.
Oh, wow.
Yeah.
So it's like a fee for, I don't know, something.
Exactly.
Retribution.
Exactly. We have to pay for what we do in our life, right? So we're paying our fee.
Pay for pain.
Right. So, you know, pain in general is just a really unpleasant feeling, right? So it can range anywhere from a pinpoint prick all the way up to something that's really devastating and almost puts you into a comatose state because it's so severe you can't handle it. And pain is categorized as acute pain or chronic pain, different things like that, and can be further categorized into kind of an inflammatory response versus more of just a chronic neurologic response.
Oh, okay.
So, you know, it can be that acute pain is that really sharp, really incredible pain. And then that chronic pain is that dull, aching.
It's always there, which makes you, and you know, that wears on human beings.
Oh, it does.
You know, on their temperament and all kinds of things. If pain just goes on and on and on.
It does, and it's definitely part of the behavioral changes that we see in our pets, as well as the behavioral changes that we experience in our own selves. We go from being this happy and upbeat type person or animal to really just kind of sad, and I want to sleep all day, and I don't really want to move, and I'm tired, and maybe I detach from my environment as well.
So that's what we're going to look for in our animals to know if they're in pain? Then?
That's correct. So they'll show you kind of a handout in a second about recognizing pain. And so the signs that you're going to see, first and foremost, one of the first signs is changes in appetite. So they don't want to eat as ravenously, or they're picking at their food a little bit more.
Boy, I sure see that. I tell you, I go through a smorgasbord of food just trying to get my older, you know, animals to eat.
Yeah.
They're like, oh, they liked it yesterday. They don't like it today.
And they don't like it today.
Yeah.
And the hard part is that everybody wants to associate pain with age, but just like in people, even children or puppies can experience pain as well. So we can't forget that pain can happen at any life stage, and so we have to really be able to recognize it from just the subtlety things. So if you have this happy, bright, young puppy that all of a sudden is hiding and guarding and sitting in the corner and doesn't want to interact with you, then it could be that something else is going on, but it could be pain-related as well.
So how do you decide if it's like acute pain or mild pain? How do you decide by their behavior? Or
so, excuse me, with acute pain, you know, it's one of those things that it kind of comes and goes. So they may hide for a little bit and then they're back out at you, you know, and they're happy. Or you might see a limp and then it goes away. A chronic pain tends to be an everyday change. So slow to rise, slow to lie down, pacing and circling around the bed because they don't want to lie down, or they have to find that right spot to get comfortable. When you pet them, they shy away from you. You feel heat as you come down their spine or down their back or over a joint. You start to feel heat. It feels really warm around it. So those are the kinds of things that you would be experiencing.
Wow. Now, you talk about wind-up pain. What is that? That's not the circling thing, is it?
It is not.
They don't have a wind-up thing on them either.
No, it's not. Wind-up pain is a phenomenon that they actually see in people and in animals both. And wind-up pain is that sensation that, the easiest example I can give you, you stub your toe, right? And it hurts. It's like, oh my gosh, that really hurts.
Gets me all wound up.
It does. Then an hour later, you stub the same toe again.
Oh.
And now you feel like you've just broken your toe. And the reason for that is because your nerves are so sensitive and are so hyperactive, they haven't had a chance to calm down. So they're on fire constantly, shooting these sensations through your body, up your spinal cord, and into your brain that tells you, I hurt, I'm in pain, I'm in pain.
I hurt again.
So with
Worse.
wind-up pain, it's the same thing. It's this chronic, everlasting cycle that goes around and around and around that says, you know, I hurt, I hurt, I hurt.
How do we treat it? Where do we start with treating
So
pain?
the biggest thing with treating pain is that we want to be able to get in front of the pain before it happens, because if you're behind it, that's when you get the wind-up. So if you stay in front of the pain, so with anesthesia, we use preemptive analgesia, meaning we give pain medications before surgery. We give pain medications during surgery, so we numb the area that we're doing surgery on, and then we give pain medications after. With injuries, the same thing. You're hurt, you don't want to wait 3 weeks after the injury and then try to get on top of the pain. You want to try to get on the pain right away.
Okay.
So you can use Western meds or you can use alternative meds.
So there's all kinds of options, and of course rehabilitation is one. Unfortunately, we're out of time. You know, things
my gosh.
whip like crazy, but we've talked about rehab before. We'll talk about it again, because at some point after this, when you find they're in pain, they've gone through surgery or whatever's going on with them, rehab can make such a difference.
Yeah.
Well, Dr. Leonda Armstrong, Circle L Animal Hospital and Paws Rehabilitation and Wellness Clinic. Thanks for joining us so much. It's always great information for those little people of ours who don't talk.
Perfect. Thank you so much.
Don't go away. When we come back, we're going